John Auerbach, and I'm from Trust for America's Health, and I'm very pleased to say that we're very much involved in the Public Health Communications Collaborative. The topic that we're focusing on today is vaccines, and we're focusing on vaccines because it's such a critical question that people on the front lines in the local health departments and the state health departments and community organizations are facing on a day-to-day basis. The questions are tricky, complicated, and the conditions are changing almost every day when we read the newspaper. There are new vaccine products that seem like they are likely to be very effective, and there are dates that are being thrown around about when they might be available. But there also are lots of questions about vaccine hesitancy and vaccine trust. And so we heard from you that it would be helpful if we spent time in this webinar throwing out what we're hearing are the questions that you're getting from the media or from public meetings or from policymakers that expect you to be the expert on vaccines. So our goal here is to give you some tips, some experience, some ideas about how to communicate effectively in response to those difficult questions about vaccines. Now, to do this, I'll just run through with you what our agenda is for today. We'll be hearing initially from Tracy Siegel, who is an expert in communications from the organization GMMB. I'll introduce Tracy in just a minute. And then we're going to hear from an expert panel of people, Drs. Georges Benjamin, Dr. Jeanette Kowalik, and Dr. Axiris Barbeau. They're people who have been on the front lines, and they are going to give you their take on how they would answer some of these questions and maybe talk among themselves about different ways of answering a challenging question. And then finally, after some questions that we pose to them, we're going to want to hear questions that you ask for them to address. And so please, throughout the discussion, if a question comes up that you have that you want to be sure is addressed, enter that into the chat section saying it's for all panelists. And then we'll be able to identify the questions. We'll pick out some questions to be asked of the members of the panel, and we will unmute you at that point if your question has been picked, and we will ask you to introduce yourself, say where you work, and then ask your question, and then the panelists will address that question. And then finally, at the end, we'll be hearing from Brian Castrucci, the president and CEO of the De Beaumont Foundation, about the various additional resources that exist in the Public Health Communication Collaborative, and some idea of our plans for the future. So let's jump right into it. We are so fortunate that we will be hearing first from Tracy Siegel. Ms. Siegel is the Senior Vice President and Managing Director of GMMB. GMMB is a firm that has been doing communications in many different public health and other health campaigns for a number of years. They're incredibly well respected. And Tracy Siegel is just one of the best there is in terms of how to communicate effectively, even when the issues are very tricky and complicated to explain. So, Tracy, I'm going to turn things over to you. I know you're going to offer some examples of how to go about answering the difficult questions. Tracy.
You certainly are. Thank you, John. Thank you very much. And hello, everybody. It's really a pleasure to be with you today. I do want to start by just reminding everybody that we are recording this webinar today, and so the entire thing will be available to you after our session today. What we're going to do now is I'm going to just walk through a few tips that we want everybody to keep in mind. We know that you're all getting lots and lots of questions, whether they be from folks that live in your community or reporters, anybody in between. And so we just want to give a few tips that we think are tremendously helpful in terms of dealing with these tough questions around COVID. The first one is we say know your audience, particularly here if you're speaking with a reporter. It's really important to note that that reporter is not actually your audience. Your audience is their readers, their viewers, their listeners. And as a result, your job is to get your message out. It's not exactly to maybe answer the specific question that's asked. We'll give you one example of that in a moment. But your job is to move your message, and regardless of what the efforts may be to take you in a different direction. The second piece of advice we have is to find common ground, and you'll also see an example of this as well. Making sure, particularly now, as people are looking for assurances, as the politics of the last number of months have divided America into different camps, it's really important to note that sharing guidance in a way that recognizes what folks are going through, comes at this, so we're all people really dealing with the same challenges, can go a long way towards softening that audience to hear the messages that you're going to share about the need to continue vigilance around COVID. The third is to avoid jargon and acronyms, and I know that for many of us, all of us that work in public health, this is a difficult one because there are a lot of acronyms, there's a lot of jargon. What we like to say at GMMB is that too much technical speak really disinvites people from the conversation. So you want to try to speak as plainly, in as common of language as you possibly can, so nobody feels as though you're sort of talking over their head about these things. The next one is practicing the pivot. As I'm sure you all know from watching the news yourselves, there are some very skillful ways to pivot gently away from a question to get back to your message. We call this blocking and bridging. One example of that is, let's say a reporter asks you, which vaccine of those in production is actually going to be the safest and the best? That may not be a question that you are in a position to answer, as we all know. And so a blocking and bridging technique might be saying, well, I can't speculate on that at this stage, but what I can tell you is this, and then go into your message about the importance of continued vigilance and your messaging around vaccines when one becomes available. The last thing, of course, is reinforcing your key points. As we like to say, the most effective messages are those that are repeated. And you should never be afraid to repeat your messages. One example is concluding any answer that you give with, again, there are 3 things to remember here, and those are never a problem to do that, always great to reinforce. So we're going to show you 2 examples now of clips featuring public health officials. These are really designed to whet your appetite. We do have a much longer session being prepared that gives lots of specific, maybe about a dozen examples of pivoting and other skills, and leaves time for discussion. But we're going to just give you 2 quick examples today so that we can get on to the Q&A. Let's start with the first one, and this is California Secretary of Health and Human Services, Dr. Mark Galey. Just prior to this clip, I just want to note, he is being asked a very long string of questions. The reporter is saying, lots of, I want to talk about youth sports. We're overwhelmed with questions about when there's going to be guidance. When are we going to know about this? Should we be more concerned about transmission locally? Should we let folks travel? And then she pivots and she starts asking questions about the problem with the high number of inconclusive COVID test results. It's one of these 2-minute sets of questions. And this is how Dr. Galey responds.
So thank you for all the questions. So look, I'm a father of 4. My kids are also desperate to find out when they might return, not just to practice and conditioning, but competition as well. So I join the ranks of parents who are concerned and want to see California guided by science and data, but also finding a way for our young people to have that important outlet, that important expression of activity. So I share with many parents, and I know a number of people on our team do as well.
All right, thank you. Just a couple of notes on his remarks. You know, again, the reporter kind of went into problems with COVID testing, and he was not caught off guard by that. He stepped back and he worked to establish a connection. He said, listen, this is something we're all concerned about. I'm concerned about it, and really worked to kind of find that common ground with the folks that were in his audience. At the same time, he got the message across, and so a nice job by Dr. Galey. Next, we're going to shift to an interview with Sarah Cody. This is actually a press conference that she was given. She was asked specifically about what do we do? What do we tell people now that we're heading into the holidays?
We across the country are concerned about gatherings over this holiday season, both Thanksgiving as well as the many winter holidays. We urge people not to travel. We urge people to stay at home and celebrate with their immediate household. We also understand that after an extraordinarily difficult year, people want to come together and find some nourishment in the company of family and friends. We have guidelines for how to do that safely. Chief among them is to gather outdoors. I will tell you that for Thanksgiving, I am gathering with my mother, who is in her 80s. She will be outside, wrapped in blankets, greater than 10 feet from where I am. So that's one way to do it.
All right, so Dr. Sarah Cody from Santa Clara County in California there, she was very steady, very calm, unequivocal in her recommendation. She said, we urge people A, we urge people B, but at the same time, we understand that folks need nourishment at this point with family and friends. Here we show this example because of her seamless ability to bring in that personal example and show by example how she is going to handle the holiday, which we thought was a really lovely way to answer that question while still being very strong on what the recommendations are. So again, we'll have a different session that gives you a lot more of these kind of examples, and we'll have the chance to talk them through. But for now, we're going to shift over to the Q&A with our panelists. And we're going to begin with me just kind of explaining some of the ground rules here that'll keep this moving forward. We do ask everyone to keep your microphone muted. We are starting with a few questions that were submitted to us in advance. As you know, for these webinars, you are always welcome to do that. We had 4 questions that came to us that we're going to begin this conversation with. We also ask you to use the chat function in the webinar here to submit any questions. You want to submit them to the selection in the drop-down menu that says all panelists, and we will be choosing some questions from that list. If your question is selected, I will call out your name and will ask you to unmute yourself and ask your question. And then John and our distinguished panel will answer. So without any further ado, John, I will hand it back to you.
Thank you very much, Tracy, and thanks for that great explanation of tips for communicating effectively. I am a former local health official. I was a city health commissioner for almost a decade and a state health commissioner for several years, and so really understand that when difficult questions come and you're thinking about how best to answer those questions, you really want to listen to someone who has been in your shoes, who knows what that is like, who understands the importance of knowing the science, but also knowing how to communicate effectively with your audience. And we've got 3 superstars, people who have been tested and done in years of being on the firing line, have figured out how to communicate well. First, we have Dr. Ixiris Barbeau, who has most recently been the New York City Health Commissioner and was previously to that the Baltimore Health Commissioner. So she has certainly worked at in a number of settings where she's understood what it's like to be a health official answering difficult questions. Next, we have Dr. Georges Benjamin, who, in addition to his current role at APHA, was a local health officer in Washington, D.C., and a state health commissioner in Maryland. And so he, too, has had his share of very difficult questions thrown at him and awkward questions to answer in the media. And finally, we'll be hearing from Dr. Jeanette Kowalik, who I'm proud to say is now at Trust for America's Health, but she only joined Trust for America's Health a short period of time ago. Up until that point, she was the Commissioner of Health for Milwaukee, Wisconsin. And so she has been dealing with the issues related to COVID up until just a few weeks ago in the role of a local health official. So first of all, thanks to the three of you. We're so glad that we have such experts on this panel. So as you heard earlier, we're going to begin by asking you 4 questions that have already been submitted by people who are planning on attending. And then after those 4, we'll hear questions from the live participants. As a reminder, what we're going to ask you to do is not answer those questions as if you were at a conference and you were explaining it to the participants in the conference, but really to answer these questions as if you were standing in front of a microphone or standing in front of a county commissioner's meeting with 100 people in the audience. We really want to understand, how do you answer the difficult questions that are thrown to you in those kinds of settings? So let's start with that first question. Okay, where are we now? This has been a very difficult year. We've had one surprise after the other with COVID-19. Where are we now in the course of this virus, and where do we go from here? And any one of you can begin.
So, John, let me maybe I can start. I certainly would answer that question is, we're in another phase, the fall phase of a respiratory disease, but we know that things usually get pretty worse in the fall. And so that we have a ways to go before we get through this virus, but we're in a very difficult time right now.
Thanks very much. Dr. Barbeau or Dr. Kowalik, you're being asked the same question. Would you answer it slightly differently? What would you say?
So I think what I would say is every day for the past 2 weeks, we have set records for the number of new cases, the number of people hospitalized, the number of people dying from COVID. And things are going to continue to get worse unless more people wear masks.
Absolutely have to go out. And I think what's important for us to know is that this will continue to be our new normal until such time that we have been able to vaccinate a significant number of Americans across the country.
Thanks very much. Dr. Kowalik, would you answer it the same, differently? What would you do?
Dr. Kowalik, you're on mute.
Sorry about that. I would focus just a little bit on reminding people that COVID-19 is a new strain of coronavirus, and we're almost at the 1-year mark for COVID, for knowing that this exists, COVID-19. So over the course of the last year, we've learned quite a bit about the virus. There's still a lot that we still need to learn, but we do know how to prevent it without having any pharmaceutical interventions at this point. We know that the mask wearing, which was noted, wearing the mask properly over the nose, not touching it after you touch it, this distancing and not gathering is extremely important. As we know, we go into the colder weather months. That is going to be really important for people to be mindful that they're not exposed and putting themselves at risk for contracting COVID-19.
Thank you. So Dr. Barbeau and Dr. Kowalik, we had a little bit of trouble with hearing you at a couple of points. So if you have headphones or if you have a different system right in front of you that you can use to communicate, you might want to put that on, just because the sound broke up for a little bit. Okay, let's go to the second question. Let's say I'm someone from the media, and I'm hearing a lot about vaccines, but people have uncertainty about that. What does it actually mean, doctor, for us to have a safe and effective vaccine? What does that mean?
I can jump in here first. The United States has a robust and rigorous system in place that's been in place for decades to ensure the safety and efficacy of vaccines that are introduced into the market. You may have heard of phase 1, 2, and 3, and basically what that means is that there is a stepwise approach to ensuring the safety, the appropriate dosages, and monitoring for potential side effects that may be life-threatening. And as of now, what we know is that tens of thousands of people have gone through these trials. And, as with every medication, there are anticipated side effects. But what we have seen is that, by and large, we've got 3 vaccines that are really on the precipice of being approved by the FDA because they have been determined to be safe and effective. Now, that's not the end of it. There is what we call phase 4, which means that there is ongoing monitoring and evaluation to make sure that even after they've gotten approval to be on the market, we're looking out for any potential unanticipated side effects.
Thanks very much.
And let me add, and what I would add to is just to tell folks that, vaccines are like any other medication. And our goal with the medication is to make sure that it will, in this case, protect you from a disease, and that the vaccine itself is much safer for you than you get the disease itself. And so when we give you a medication, we're giving it to you with the intent of making sure that you will not get the disease and that the vaccine itself won't make you any sicker. Effectiveness means that it works in most people. And if you think about any other medication that you take because you know that it helps you get better faster, and that, again, that it doesn't make you so sick. Now, it doesn't mean you won't have a sore shoulder. It doesn't mean you may not get a fever. It doesn't mean that you won't get some mild symptoms for a while. But the idea is that in almost everybody, it does it in such a way that you don't get really sick by taking that medication.
Great, thanks. Dr. Kowalik, anything you'd add?
Yes. So the point about the vaccine going through the traditional trial process, so the different phases that any medication goes through, is extremely important to stress that that's what's happening here. There's no shortcuts that are happening with the trials. So with a professional, I say that with confidence. I understand that there have been some questions about transparency and information being released about the vaccines that are going through the trials right now. But there has been a number of opportunities to learn more about the technical side about vaccine development. And I think that's important for us as public health professionals to pay attention to these things and not necessarily translate all of the sausage making to the public, but just the point of knowing that the process is being followed and that there have been some innovations in technology for vaccine development, which has helped move this process along. The Moderna trial is 1 month ahead of schedule, which is great. But again, just acknowledging that the vaccine development process is abiding by the FDA trial process. So that's extremely important to stress.
Thank you. Thank you all. Let's go to the next one. I think the next 2 questions continue this series of focuses on on whether people can trust vaccines, and there are certainly a lot of questions about that. the percentages of people who say that they're ready to be vaccinated now are in some communities quite low, and often less than 50%. Again, let's say that you're at a community meeting where you've got in the audience, you've got some people who you know don't trust vaccines. And maybe you've got some people who trust vaccines, but they don't necessarily trust this vaccine. They feel like maybe this has been rushed. And so you're asked to step up to the microphone and just, tell us. There are a bunch of people in this room who are hesitant about a COVID-19 vaccine. What would you say to them?
I can kick this one off. So again, looking at how the vaccine is being developed, as with any other medication or any other vaccine, that the vaccine is being developed in a way that's safe, that's minimizing risk to those that are receiving the vaccine through the trial. So my other point is reminding people about the importance of preventing vaccine-preventable disease. So we were seeing outbreaks even recently of measles and other throwback diseases that I like to call them throwback diseases that have vaccines that are preventable. But when we see the herd immunity drop, or that there's no herd immunity, then we start seeing these viruses show up again, and then we're reminded why we need to get vaccinated. So just because you don't see something doesn't mean that you don't do what you need to do to prevent it. I do see now with COVID that there has been at least some acknowledgement of the significance and importance of having a vaccine to help us get back to living, right? But there is concern about the vaccine development process and if it should be, if we should trust it or not. And again, just reinforcing that the process of developing the COVID-19 vaccine, and there's many pharmaceutical companies that are in the process right now. There's ones that haven't started yet, like some of the protein-based vaccine trials, but that there are a number of different players here that are working very diligently to get a safe and effective COVID-19 vaccine on the market. And one last thing that I want to stress, and this is just reflecting on my experiences as an immunization manager in the city of Milwaukee, of some communities of color questioning the quality of vaccine that's being issued for free versus those that are provided to people that have health insurance, and reassuring the community that the vaccine type that's being that's made available is based off of just that availability, that there won't be any lesser quality vaccine that will be given to certain groups of people. We know that COVID-19 has been really hitting communities of color the hardest. So that is the priority, to make sure communities of color are vaccinated and protected from COVID-19.
Thanks very much.
Thank you.
I'd probably add that there are three questions that you want to ask. Number one, why should I take this, and why am I at risk? Who's at risk? The second question is, why should I trust this vaccine? And the third thing is, are they really experimenting on me? That, so they can give this vaccine to other people. And I think the answer to those three questions are, number one, that we see that more people of color are disproportionately at risk. More people get hospitalized, more people die sooner. And therefore, this vaccine is designed to hopefully benefit us, and that's why we ought to take it. Number two is it going to work? And the answer is that they have included enough people that are of color in the studies to show that it works on everybody. And number three, are we just being guinea pigs for this, and are we going to have equal access to it? And the answer is no. The way that the plans have been designed is that everyone should have equal access. But to ensure that that happens, we have to demand equal access, just like we have to demand that for everything else.
So I'll add to the responses just by saying, John, I'll put myself in that community meeting as you suggested. And, I would start off by saying, I can understand why people would be hesitant about receiving a new virus. And, this virus indeed has been prepared faster than any other, this vaccine has been produced faster than any other vaccine that we have out on the market. But that doesn't mean that any shortcuts have been taken. And, we want to make sure that people are aware of the systems that are in place to ensure the ongoing safety monitoring that happens. And while we may not have, truthfully, all of the answers yet, because the proof is in the pudding as more people in real world situations do get vaccinated, the point here is that we want to create an ongoing dialogue so that we are here as the health department to answer questions that we have the answers for now, and to just be clear with you that there may be some questions you present to us that we still don't know the answers to, but that we're committed to coming back to you with responses for and giving you the resources where you can see for yourself what the science is. Because the reality is, from the very beginning, what we have said is that we back in February, March,
this virus every day. And this is the kind of situation that we're in with COVID, where we're learning new things every day. And the point is for us at the health department and you in the community to hold each other accountable for making sure that we all have the best information to keep our families and our communities safe.
Thank you all. I think we're going to probably get a few follow-up questions because I have a sense that many questions are coming in from the listeners. So I'm going to hold off asking you some follow-up questions and let the people that are participating do that. And this is the fourth of the and last of the questions that were submitted early before we open up the lines to hear questions from the participants. And this one is the kind of late-breaking news. Just in the last week or so, we have heard that both Pfizer and Moderna have very high effective rates and are feeling pretty comfortable about getting ready to submit their proposals for approval to the FDA. Just today, I think we've heard AstraZeneca may also be in a position to do so. So, does this mean once we start vaccinating people, can we stop wearing these terrible masks? Can we stop having to distance? Can we just get our kids back to school and go back to work? And can we, is it right away once the vaccinations start that we'll be able to get back to normal? Once I get vaccinated, can I just go back to work?
So I could start on this one. I would say I'm excited by these 3 vaccines getting ready to be on the market. I'm excited because it is light at the end of the tunnel, but I don't want anybody to think by any stretch of the imagination that we're going to get back to normal anytime soon. I think we need to be clear with everyone that until there have been a significant number of people vaccinated in all of our communities, that the use of face coverings has to continue to be a part of like our everyday wardrobe. If you have to go out, make sure that you've got your face mask on.
And John, I would add that, yes, I would say this is wonderful news. And it's an additional tool in our toolkit for us to control this disease. But in the short term, we're going to have to still wear a mask, wash our hands, keep our distance. And then as more and more of us get vaccinated, we'll be able to get further back to normal. But we're not here yet, and that we have a road to go. Just remind folks that we're basically, for all practical purposes, only still 10 months into this outbreak. And I think most projections are that it's going to be early summer before we'll have enough people vaccinated to make a big difference.
And I agree, this is exciting news. We're seeing technology and innovation play out. But just a note of caution, this is about the vaccine, but we need to focus on the vaccination. So how are you actually going to get the vaccine? So there's still a number of questions and protocols and plans that need to be finalized on how each state, each local health department will be able to support vaccination campaigns for COVID-19. We also know that mask wearing, although it may be not as well received by some people, that it's a very low cost intervention. Just like most things with public health, very low cost interventions, like hand washing, for instance. But there still needs to be some support in embracing this new way of living, wearing masks, distancing, and increased hygiene. I think today I saw something about how there's been a decline in enterics or stomach-related diseases or viruses, things like that. So it'll be interesting to see how mask wearing and increased hygiene and distancing will impact other diseases and also possibly reduce infection for other diseases as well. So again, just tying it back to the importance of vaccination, making sure that everyone can access the vaccine, and that's going to be based off of your risk. For instance, first responders, healthcare workers will be the top tier. And then after that, there will be high-risk individuals, and then going all the way down the list of who will be able to access the vaccine. So knowing that just because these vaccines will be on the market doesn't mean that you're instantly going to get it right away. It depends on your level of risk.
Great. Well, thank you for the three of you. And we well, now I think we'll switch to asking some of the questions that people who are participating. And Tracy, I think you're going to call out the name of the people who have submitted them, and maybe we'll take them off of mute and hear the questions.
Absolutely. I'd actually like to start with Brian Castrucci, who had one follow-up question to to the answers that were just given. Brian?
Thanks, Tracy. So like John and Jeanette, I am not a clinical public health professional. I am trained in public health. I have no clinical background. How do you, as non-clinicians, engage in this conversation? Do you feel that we have to answer questions differently, or we could be flanked by an MD? But I mean, some of this isn't necessarily clinical, but what are your thoughts on that?
Yeah, I have two perspectives on this one. One, depending on, say, the jurisdiction, there may be a requirement that the health officer is a physician. And then others where the health department has a medical director and a health commissioner or a health officer. So it is nice to have someone with a clinical background available to help answer any of those types of questions that you may receive from the public or the media. But I also like to just remind everyone that we also have to acknowledge that every field has its own science, its own best practices, its own way of being. For instance, fire science, right? Like no one's going into the details at a 5-alarm fire on how they did their firefighting, but there's a science to how they did it. So basically preparing, knowing your audience, as that was noted, but just acknowledging that we're public health professionals and that we have studied this work. And for those of us that are more in administration or generalists versus those that are in specific areas within public health, that we have to really lean on our subject matter experts to help to distill some of these more technical questions that we may receive related to, say, COVID, for instance, you want your CD or infectious disease folks to be on hand.
Yeah, I would agree with that. I would. I've been in those situations as well that you're describing, and I'm a non-physician, and I found it helpful to follow what Tracy was saying. In doing an interview, I usually would try to know ahead of time what's the 1 point or 2 points I want to get across, and no matter what they asked me, I would answer those questions. And then if they asked a question that was just super technical, I think I would say, for that question, I'm going to refer you to our director of infectious diseases, or for that question, our medical director will be the expert. But and almost I never saw myself quoted in the media saying that. I think they really just wanted usually in media, they just wanted a clip of me saying something. And if I stuck to the message that I decided was the right message, that would usually work. Of course, it's different in a community meeting. In a community meeting or in front of, say, elected officials, I would go to that meeting with the medical experts standing right next to me. So if that question arose, I would turn the microphone over to that person. Tracy, next question.
Yes, you bet. For the next, we'd like to open it up to Jan Heinrich. Jan, please ask your question.
Everyone, my question is about our lack of preparedness. And how would you answer the question, why aren't we better prepared? Why aren't our state and local health departments more proactive? Why don't we have enough PPE?
Yeah, of course, Jan, you could write this. You could write the answer for that for all of us. But as you know, the answer is that our nation is not invested in prevention and public health as we have invested in, upstream conditions like ICUs and medical care. And we're going to have to, once and for all, make the kind of investment so that we can get a better containment on any time a disease enters the community, that we can rapidly identify it, that we can contain it, and build the supply lines necessary to address these kinds of disease outbreaks. These are problems that we've had for many years. And a nation, we just watched the capacity ditter away, despite the advocacy from many public health groups and some consumer groups.
I agree. The point about investment in public health definitely has impacted our ability to manage COVID-19. However, we had a pandemic playbook, so we know that there were many efforts that went into developing a plan. But what is a plan if you don't follow it? And not only that, if the plan's not funded. So always using this opportunity when the community or media are pointing fingers to bring it back to adequate funding, level funding for public health. That includes not just the money for staffing, but also for systems and innovation.
Yeah, I think I would just add that, this is clearly a situation where everyone is contributing to moving the country in the right direction in terms of responding to COVID. But the reality is that the plans that we have had in place haven't been fully executed because we haven't had the kind of support that public health needs. This is not a situation where the way that things were funded before are going to help us, meaning that we can't have a panic and neglect cycle of funding public health. This is, kind of the worst case scenario, if you will, of how it is that unless we fund what's important, we're never really going to move forward and away from being reactive and more towards being preventative.
Thanks very much. Those are great answers. Tracy, next.
Thanks. Yes. For our next question, we'll turn to Jacob Waters. Jacob?
Hello?
Hi, Jacob. We can hear you.
Hi. So I was just wondering, how do you respond to false statements, especially in social media comments?
Jacob, want to give an example of, why don't you pretend you're a media person who's saying one of those false statements, and that might give them a chance to respond specifically to that.
Okay, an example would be if we're posting some messaging reminding people to wear their masks when they can't social distance, and then someone will post something saying that masks don't work, or post to some fake news site saying that masks are not effective.
Thank you.
Mm-hmm. One of my suggestions for this one is, as a part of your incident command or pandemic response team, is having a core of people dedicated just to that, to snuffing out any misinformation. So they're scouring various social media outlets. They're receiving intel from the community or partners, and they're working to shut down any opportunities to spread misinformation. Really being intentional about this is going to save you a lot of work, doing a lot of damage control. So it's just, that side, but then you go upstream to try to make sure you're preventing misinformation from the start. So really leveraging your community partners. Many of them have their own social media presence. Like we had one with our Latinx community. They had like twice a week Facebook Live sessions, and then they had all of these other engagement opportunities, but they would have various health department people, including myself, on to just give an update and answer questions for the Latinx population in Milwaukee. So that really helped shut down some of the issues that we had with some people that were really, really spreading misinformation. And we were like, no, you have it all wrong. So we were able to leverage it that way. So the twofold, taking it at the, stopping the bleed of the misinformation using this core, and then the other side going upstream, making sure you're shutting down misinformation before it starts by being present.
Well, that's a great counseling and strategic approach. For the other two panelists, I'm going to actually ask the question. I'm going to say, a leading senator in the state legislature has questioned whether there's any value at all in wearing masks, and that questions why we would even think about making those recommendations or mandates that people wear masks. He's saying there's no evidence at all they work. How would you respond?
So, John, for me, I would say that the evidence is very clear that masks work. And I'm going to get Senator John on my calendar so that we'll meet with him and talk with him about, share with him the evidence. But if folks really think about it, when you put a mask in front of your face, just think about what actually happens when you're in front of somebody. All that stuff coming out of your mouth gets blocked by that mask. And that's just common sense. And it turns out that the evidence supports common sense. But I'm going to meet with Senator John and share with him the evidence that we know that masks work.
Yeah, I think George has got it. I don't know that I would say anything differently. The other thing that I'll say, going back to what Jeanette offered, is I think it's critical to have people dedicated to responding to social media. I think there needs to be a balance between, you don't necessarily have to respond to everything, because that then just gives them more fuel for the fire. I think being strategic about what misinformation you think might be threatening to the health and safety of your community, The other thing is, I know that some health departments, and I think Kansas City has done this, we in New York City have tried to do this, using graphics or having a little bit of, and this is could be a little bit dangerous, but it's still worth exploring, a little bit of humor in responding so that, again, you answer the question, you draw attention away from the attention seekers that are trying to, have this misinformation get legs, if you will, and then you provide a service to the community.
Mm-hmm. And I'd like to add one point about the direct response is using your own experience to show the relation to what the question is about. So, for instance, asking or saying that masks don't work and then you responding that yes, they do. Personally, as someone with multiple autoimmune diseases that started wearing masks last year for travel, helped to keep me healthy and also possibly keep other people healthy as I was traveling. And that was in response to an infection that I acquired from traveling at one point. So nonetheless, just if you're comfortable sharing your experience, sometimes that helps to show some relatability to whoever's asking the question or making the statement.
Yeah. And that may be connected to what Tracy was showing earlier about the elected official who talked about what she was going to do with her mother and how she was going to celebrate Thanksgiving. Tracy, before you get to another question, I want to ask a tricky question for the panelists because this has been, as we all know, public health has become caught up in political partisanship. And so one of the tricky kinds of questions that sometimes gets asked is, are you blaming? Are you saying, I'll ask the question then. Are you saying that we're not prepared because the White House has adopted the wrong policies, or because your governor hasn't done what the mayor said should be done? You could adopt the specifics of that. But the main question is that the reporter is asking you, aren't you saying someone's to blame who's a political figure for failing to do what's necessary? How do you answer that?
I usually just simply say that, we as a society need to rebalance the spending that we had. I remember when I was an ER doc, and I, got into public health because we were spending a lot more time taking care of patients one by one. And I discovered that the best way to do this was for us to deal with people on a population basis. And I just think that we as a society need to invest more in public health. And my organization has been advocating to do just that.
So just not take the bait. You're saying don't take the bait.
Don't take the bait. Now, that's what I did yesterday, but.
Yeah.
I'd answer it in a different way. I would say, I think that when there have been 250,000 Americans who have died because of COVID, it's not a time to point fingers. It's a time for us to come together and to focus on what are the messages that are going to save the most lives now. This is not a time to be pointing fingers.
Good point.
I really, really agree with that position because centering it on there have been a number of people that have died and families, communities, elders, the impact of COVID-19 is real. So centering it back on what really matters to avoid getting into this partisanship type of approach. But on the side of that, I have at certain points just stuck to the facts, and the facts were very telling. So, of course, coming from Wisconsin, if you're aware, if anyone's on from Wisconsin, about the political gains that took place related to the Wisconsin Supreme Court and blocking the statewide orders. I mean, even today they were talking about Madison-Dane County overstepping that was the whole point, was to allow the locals to make these decisions, not the state. So just sticking to, we know that orders work, enforcement of orders works, just keeping it just matter of fact, and then let them kind of go from there, but not saying, oh, governor this or this person or anything like that. That's not wise.
That's great. Thank you. Really good answers from all three of you. Thanks. Tracy, over to you.
Thank you, John. Our next question comes from Michelle Hutchinson. Michelle? Michelle, are you still with us? If not, I do want to...
Why don't you ask her question?
Sure. Michelle asked, we know that you recommend getting an annual flu shot before flu season so that you can have a few weeks to build up immunity before the virus begins circulating. With each of the COVID-19 vaccines, how would you answer questions about how long we can expect it to take for our immunity to build up?
I think the short answer is that in most cases it takes a week or two.
Mm-hmm. Yeah, I think what
is just from my perspective, we know from other vaccines what it typically takes. I think that we need more information about what we'll see with the COVID vaccines, but I think what's really important for people to remember is that this is a 2-dose vaccine. It's not enough for people to just get 1 dose. We need people to get both doses to get the maximal effect.
Great. Thank you.
Thank you. Thank you for that.
Tracy.
Yes. First, just a quick reminder to everyone that we would love for you to submit your questions. We do have time for a few more. So to do so, please go to your chat box and select all panelists and submit any questions that you would like answered. In the meantime, I would like to recognize Anna Tomasulo. Anna says that she's having some audio difficulties with her mic. So she's asked me to read her question as well. She says, do you have recommendations for messaging around side effects? For some people, they don't want to get the flu vaccine because they think they get sick from it. It's been reported that side effects have been more noticeable with the COVID vaccine than with the flu vaccine.
I can go ahead and start. I think it's important when we get the question about side effects to start with the fact that, side effects from vaccinations are not anything that is, actually, let me restart. Side effects are to be expected for many people when they get vaccinated. What it means is that your immune system is working. And so it's very common for people to have local side effects like redness, a little bit of tenderness. Some people may feel a little bit run down. And when they get the flu vaccine, oftentimes people think that it means the vaccine has made them sick. This is absolutely not the case. It means that their immune system is working the way that we want it to. Now, with the COVID vaccine, I think that we have to be prepared for some additional side effects. And the main thing is that we don't want these side effects to keep people from getting the second dose, right? Because if you get the side effects from the first dose, you're going to say, no way, no, how am I going to get the second dose? It's important for people to understand that we anticipate a significant percentage, maybe somewhere up to 20%, may get those side effects. Doesn't mean the vaccine is hurting you. It actually means your immune system is working the way we need it to, and we need you to get that second dose.
That's perfect. I don't have anything to add to that.
My only thing, I guess, sometimes this is over people's heads, but if vaccines are live or using a killed version of the virus, and like the point about the perception that getting vaccinated makes you sick, which we all know is not necessarily the case, as most vaccines are not live virus. So just acknowledging that. And then also that the VAERS system or the federal reporting will be set up. Anyone that gets vaccinated will be 1 year after, there will be an opportunity to monitor for any side effects so that there can be any updates on, say, the vaccine information sheet, or if there's something, unusual side effect that may occur that is being tracked and that some adjustments are being made along the way. Again, this process is adhering to the traditional process, but the innovation has been enhanced for COVID-19.
Well, let me ask, Tracy, I'll just interrupt for a second and ask a question that I actually have heard people say. I've heard people say, maybe it's better to wait 6 months after a vaccine is out to make sure it's safe. Let other people, that way you can see whether other people have really negative side effects or something they didn't find out during the clinical trials. I'm not. What would you say to the people who say, well, I'm not going to get the vaccine when it's first available. I'm going to wait 6 months or a year. That way I'll find out if it's really safe.
What I tell people is that, and we have several new vaccines that are going to be available, and each of them has their pluses. You should talk with your healthcare provider to decide which type of vaccine you should get and when you should get it. And I think that's important because if you are in the high-risk category and you're out and about as an essential worker, I would encourage you not to wait to get the vaccine. If you are association executive who can work from home, like me, then I won't be high priority anyway. But I'm going to get it later, not because I'm waiting, but because I'm not a high priority person to get the vaccine. And I think we have to refer people back to their health authorities to tell them, to give them their advice, because in some cases, they absolutely shouldn't be at the front of the line, but in other cases they should. And I would not want to discourage anyone who ought to get the vaccine early on from getting the vaccine. Because we know the result of getting the disease in those high-risk individuals. They're going to have a much more serious clinical course.
Thank you.
Thank you very much.
Tracy, over to you.
Oh, we're ready for our next question?
Yes.
We will go to America Davis. America.
Hello, good afternoon. Thanks to all the panelists. This has been a really great discussion. I have a question specific to healthcare workers. Our state is currently planning to roll out the vaccine, and those in our first tier of those who are going to receive the COVID vaccine are healthcare workers. We've already experienced some pushback from these practitioners. How would you approach someone who you would assume or who you would hope would have the clinical background and the experience enough to just understand the importance of vaccines? And how would you kind of talk through their concerns and questions?
So I think you have to approach it in a couple ways. Number one, you have to talk with them about protecting themselves and their families, particularly those people that are at high risk, high risk clinical providers. So ICU workers, emergency department workers, nursing home workers. And you just have to share with them the information and the data. And then the other thing is you have to remind them of their responsibility to protect their patient. And the fact that, again, over 40% of the people who have this disease get it and transmit it asymptomatically. Even with a very vigorous testing program, it's not 100%. And we've seen that in other outbreaks in places that are doing very rigorous testing. People still slip through the cracks. So I think that that's certainly the one way to approach it. I can tell you that when I was practicing emergency medicine, we were required, as a matter of practicing in that hospital emergency department, to get vaccinated with flu every year and get hepatitis B vaccinations. And quite frankly, in the hospital I was at, clinically, we were required to do that. Otherwise, you couldn't practice. Now, I don't know that we're at that point yet, but I do think that that's going to be one of the occupational health discussions that some health institutions are going to have with their clinical staff.
Yeah, I think that one it's a real concern, right? I've heard recently the state health commissioner for New Jersey talk about how like 40% of their nurses would be willing to get vaccinated. Everybody else is like, I'm going to wait. And, you know, the issue there is, I think, engaging the healthcare provider community from both a sort of data perspective, ensuring that they have clarity on knowing exactly what phase 1, 2, 3 actually mean, and sort of appealing to the more data nerd in them. And then also, I think, you know, talking about the real life consequences. They've been working for 10 months under incredibly stressful situations, not knowing if their next shift is going to be the one where they get sick or one of their colleagues gets sick. And why have that ongoing stress and anxiety and you know, they've got incredibly stressful lives as it is already. Why continue to take that risk when we know that the vaccines that are going to be released have gone through all of the safety checks? We're not cutting any corners. And so I think for me, I would try sort of a balanced approach between the emotional and the data driven.
And let me add to that. I think Dr. Barbeau's right on target there. And just remind us, at least realistically, all we know about these vaccines right today is from press releases. So once the FDA does their studies and their committees report out, and it gets published in the medical literature, because I'm sure there are going to be publications of the outcomes in the medical literature so that the healthcare community can see it, then I think you'll get, and assuming everything works, then I think you'll get verifiers. And then once those verifiers occur academically, more people will much more likely be willing to take it. And then once they see their colleagues getting vaccinated and there are no untoward events, then they're much more likely to have confidence in the vaccine.
Mm-hmm. And I agree too, the point for healthcare workers, I see this twofold. One, for healthcare administrators to make sure that they're doing some type of assessment of their healthcare workers about their perception, knowledge, and beliefs about the vaccine and about COVID-19. Just because someone is a healthcare worker doesn't mean that they know everything that we know, that they're pro-public health per se. So there needs to be some assessment, because that alters how you're going to roll out the intervention. And then the other side of it too is the peer support, the peer pressure. So if you know that colleague X is someone you look up to and they got vaccinated and they said they didn't grow horns or something crazy after being vaccinated, that you're going to be more apt to maybe getting vaccinated too. So what can we do to really spread the good news that the vaccination is effective and safe and working? You know, there has to be some marketing strategy that goes into play. Is it some kind of little pin or ribbon or something? I don't know. But just kind of looking at how do we increase of the uptake of the vaccination efforts by using psychology and all of these other disciplines to increase support of it. So I've been thinking about this, like how are we going to strategies?
Thanks. Tracy, I think we have time for one more question.
We do indeed, and that question is from Lori Freeman. Lori?
Oh. Sorry.
Lori, are you still with us? How about Alan Wyman? Alan, are you still with us?
This is Lori Freeman. I'm sorry.
Oh, great. Hi, Lori.
Hi. I wasn't sure if you're going to call on me or not because my question may have already been answered, but maybe not exactly all components of it. The first part of my question was about how do you go about changing the minds and hearts of the 50% or whatever percent we know of the population that have indicated they would not get the vaccine or sure if they would get the vaccine. I think that you covered that. But the second part, maybe not, but it was what about those large numbers of people who simply do not believe the virus is real? What strategies can we take to when there's just such resistance that the virus even exists?
And so that's a great question. In answering it, first say how you'd answer the question if you're asked at a meeting, do we even know this virus exists? And then I think Lori's also asking, what are the strategies that should be used? So if you wouldn't mind both giving your answer and then talking about strategy.
Mm-hmm.
Well, I answer the question pretty simply. Yes, this virus does exist, and it is a new virus. And I encourage everyone. My best medical advice is for people to take the vaccination because I believe it works. Now, I do recognize the fact that in the real world, in the reality, is that our nation has experienced this outbreak very differently. It hit first the urban settings, now it hit the rural communities. And in those communities where it wasn't prevalent in high numbers initially, plus the misinformation, there was a lot of doubt. I think that doubt's fading very quickly, tragically, as they're seeing the disease. And as you know, there's a lot of people who said they won't do something, and having a debate about something that's not there yet. I believe that once we get a vaccine that's in public distribution, and that they see people are getting it, and as my good friend Dr. Kowak said, they don't grow horns, then I think more and more people will begin to take the vaccine.
Mm-hmm.
And if they're only small horns, they still might take the vaccine.
But that's another point that I wanted to stress is that, yes, this is real. And the surge that we're seeing in our country, it's only a matter of time before everyone can say they at least know one person that has had COVID. Either they recovered, they have long COVID, or they perished from it. And unfortunately, that's the situation that we're in right now. And it could have been totally avoided. I also, again, as a public health professional, like to stress the significance of storytelling and connecting people to real stories and real experiences with COVID-19. This was unfortunately helpful for me early on in our COVID-19 response in Milwaukee, because one of the first people that passed away was someone that was an elder in the community and actually was in a process of giving me an opportunity to teach for one of the universities. So he was somewhat of a mentor in a way. But many people lost, knowledge and tradition and elders, and you're going to see more of this, unfortunately. So I think sharing these heartbreaking stories of people that have passed, people that have long COVID who are not the same, and then people that were like, my symptoms were mild, but I know this person that is still dealing with this, or they are still grieving the loss of their loved one.
Thank you. Thanks. By the way, I want to say a special thank you to Lori Freeman. Everyone may know that Lori is the president and CEO of NACCHO, and so she spends all day long, I think, hearing from her members that are local health officers about these kind of questions. And Lori's been a great partner in the Public Health Communications Collaborative. So thank you, Lori, for all you're doing all the time. I know every day you're helping people with the communication issues and a lot more. Well, I think we've run out of time in terms of the panel. So let me just say to the three of you, thank you, thank you, thank you. Any community I live in, I would want you to be the health commissioner so that you could be answering the hardest questions, and I would feel so confident knowing that you were in charge. So I really appreciate your being willing to do this kind of exercise with us of answering these hard questions. So at this point, I want to turn things over to Brian Castrucci. Brian is the president and CEO of De Beaumont Foundation. And as I said at the beginning of this webinar, De Beaumont Foundation is one of the core funders for this webinar with the CDC Foundation. And Brian, in addition to being the head of the De Beaumont Foundation, also is somebody who learned by working at the front lines. He was working at both in health departments at the local and the state level, and got difficult questions often asked of him. So we appreciate, Brian, that you not only are leading a foundation that's supporting improved communications, but you're also someone who has fielded those tough questions when you were at the local and the state level. Brian, over to you.
Thank you, John. Yeah, I have the scars. We can all compare scars at some point in the future. I have a great respect for everyone on this call who works in state or local government. It is one of the hardest jobs right now. And what we know, for those of us who've worked there, is answering questions is one thing. Answering questions in a governmental public health context is often much harder. And so one of the things I wanted to point out here are just the resources that are available on the PHCC website, publichealthcollaborative.org. Please use them. And in the chat, we would love any recommendations for other tools that you need. The entire idea behind the PHCC is that we all shouldn't be working as 3,000 separate entities, having to come up with our unique graphics and unique messaging, and that we can be stronger together. And so we're trying to meet that need with the website. So please, as you can, visit the website, sign up for the emails, do anything you can to engage with us. If not in the chat now, please email us. If you go to the next slide. Oh, these are things that are coming. A template op-ed about the importance of vigilance this holiday season, with some guidance on tailoring and pitching. We always have most shared news updated every 30 minutes. And this week in misinformation are some briefs on social media as to what is trending out there that is maybe not helpful to public health. I have been quoted regularly in the press around sports and how sports is not particularly helping our goal to educate people about COVID. In many ways, it's working against us. It's one thing for a public health official to tell people about the dangers of COVID. That is very hard to communicate when folks are rushing the field at, when Notre Dame beats Clemson in college football. Of course, the only reason they beat Clemson was because Clemson's quarterback was out due to COVID. And so the irony there, I think, is amazing. We also have a Q&A that is regularly updated as there are new developments. So again, please go to the website. There are good resources there. This entire initiative is really trying to help folks on the front line. So the more that you can tell us what you need, what you want, we can try to be responsive to that. So if not in the chat now, hopefully you can email, next slide, either Mark Miller at DeBeaumont or Rhea Farberman at TIFA. And so if you have needs, if you have questions, please push it to my colleagues, both at DeBeaumont and at TIFA, because we want to really make sure that we are being responsive. And we can't be responsive if we don't have direct input from the field. So, with that, I want to thank everyone on the call. There's a rich source of data in the chat that we will look at and think about and really figure out how best to move us forward. There is no need for us to be doing this alone. We have colleagues, we have technologies that allow us to connect even when we are not, together. And so let's make sure that we are working on this together, that we are asking for help, because what we can do is provide that. I want everyone to make sure over the holiday to take some time for yourselves. Self-care right now, guys, is of a huge priority. And there's enough attack on public health workers that we don't need to attack ourselves. So please make sure you take some time, reflect on where you are. We would be so much worse off without the work that you all do every day. And you might not get the love as regularly as you should, but there are many people out there who respect you, worry about you, and care for you very much. So take a good time to try to relax, find a moment for yourself and your family over this holiday weekend before we gear up for Christmas in 30 days, and then New Year's Eve, which will also be events that we're going to have to deal with. So stay in touch, stay safe, and thanks everyone for joining us today, and thank you to our excellent panel. And with that, I will give you 7 minutes of your life back. Thank you, everyone.